You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at mothertobaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I'm a genetic counselor, a mom of four, and a teratogen information specialist. So what I do is I talk to people, so patients, their family members, and healthcare providers about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So a medication, a vaccine, a chemical that you work with, lots of different things. And Mother to Baby can answer your questions. Today, we have a special guest who's going to talk to us about a question that we at Mother to Baby get pretty frequently: weight loss. And to talk with us about that, we have Dr. Sarah Obican. Sarah, welcome back to the show.
Thank you so much. Thanks for having me. I'm Sarah Obican. I am from University of South Florida. I am the medical director of MotherToBaby Florida and the division director in maternal-fetal medicine.
Excellent. So we're going to jump right in with some general information. So generally speaking, losing weight on purpose during pregnancy isn't usually recommended. Is that right?
Yeah, that's correct. So we do prefer that the weight loss occurs prior to pregnancy because that can impact the outcome of the pregnancy. We have better perinatal outcomes for both mom and baby if the weight loss occurs prior to pregnancy. And that's a notable kind of statistically different finding. The issue is during pregnancy. We do not recommend weight loss during the course of pregnancy.
Is there any time when weight loss would be appropriate during pregnancy?
Not really, actually. We do recommend a really healthy lifestyle for our patients, an appropriate diet and appropriate exercise. We love our patients being able to walk and, if able, use the pool so they have some exercise and even building some muscle, which helps to decrease the risk of gestational diabetes during the course of pregnancy. All of that is great. And sometimes what that does, and this is very important, is that it staves off the kind of high increase and the fast increase of weight during pregnancy. It certainly happened to me. It's very, very common. It's easy to do, right?
Yeah.
But that kind of exponential growth can be really kind of staved off if we implement some of these things, such as like small amount of exercise and good nutritional choices during the course of pregnancy. But actual weight loss, we don't really recommend losing a tremendous amount of weight.
Now that we have that basic idea established, I am sure that you've heard, it's all over social media, this medication called Ozempic that some people were using outside of pregnancy or breastfeeding in order to lose weight. What information do we have about the use of Ozempic in pregnancy and breastfeeding? Because it's not just for weight loss. It's actually used to treat something different, but that's one of the effects of it. So what information do you have on that?
That's a great question. So it is very popular right now, and it's very effective, it seems like, in patients who have diabetes. In a population who are interested in using it for weight loss, it does seem to work in some patients. We don't recommend it in pregnancy, and that's really from that baseline idea of we don't recommend losing weight during the course of pregnancy. And the truth is we don't have enough information yet, right? You can't find enough information in terms of human data of what are these outcomes going to look like for the future. Again, because obesity has a big impact on our pregnancies, it might be helpful in the long run, but we don't know that now. We don't know what are some of the potential effects of that, not only about organogenesis, but maybe even development of different kinds and growth restriction and so forth. So it's not something that we would recommend in pregnancy.
And the good news is if someone does have diabetes in pregnancy, there are other ways that they can be treated.
Absolutely. There are a lot of different things, and it's not one of those kind of one medication fits all or one treatment, right? It's almost like this combined efforts that we have to do for any chronic disease. And so nutrition is really important, and having access to a nutritionist and having access to somebody who is really comfortable with prescribing medications in pregnancy, such as somebody like an endocrinologist or a high-risk obstetrician. And really the treatment is usually an insulin of some type or something that will modulate how your pancreas works during the course of pregnancy. So like a medication that you can take by mouth, a pill. Again, insulin still being that gold standard of what we know works the best in patients who are hard to control for the diabetes aspect per se. For the obesity portion of it, again, it's a modality that is combined, nutrition and exercise and some psychological work too. I think there's a lot to be understood about that aspect of how we are in our weight loss journeys.
I think that's such an important point to remember. There is the physical piece of it, but there's also that, how people think about food, your relationship with food or exercise or whatever the many components are. It's a really good reminder that it's, again, not a one size fits all and not a one issue that will take care of the entire problem.
Yeah, you're absolutely right.
So let's move away from the prescription piece of it and talk about, again, very hot right now, at least in terms of people talking about it, a supplement called berberine. So what about that in pregnancy or breastfeeding?
So with any supplement, that's actually the underlying issues, that we don't have any regulatory bodies that are helping us know what is actually on the market. So these medications don't have to be evaluated prior to being put on the market like a medication that is FDA approved, let's say. So that's the biggest difference. There's been a study now many years ago which looked at how correct is the label of a prenatal vitamin to what's actually in the prenatal vitamin. And interestingly enough, even though folic acid and prenatal vitamins, what we expect that all our patients should be on prior to pregnancy and during pregnancy, the values that are on the label are not necessarily what's actually in the pill. And that again is because the vitamin industry is not necessarily regulated. And that also happens with herbal supplementations. We have to be really mindful of that. The other piece of it is that maybe this herbal supplement works in a patient population that's not pregnant. We have no data really in pregnancy.
Yeah. Again, with the lack of data, and that, in our world certainly is something we come across quite a bit. Not necessarily that there is a risk or is not a risk. It's just we don't know because we don't have that data.
Yes.
So what are some tips for someone who does want to either get to or maintain a healthy weight, either, before pregnancy, as you mentioned, but also in that breastfeeding period?
Oh, yeah. So before pregnancy, that's a relatively easy one, although, gosh, I think of weight loss, even in my own journey, that's never easy, right? But it is easier in the sense that it's before pregnancy. So you have a lot of ability to kind of make that change and impact, and really giving yourself grace and the ability to have time to do that. And maybe if you have that opportunity to maybe plan it, right? So you say, okay, I'm going to give myself this 6-month period or a year period to really make sure I've seen all my physicians, that I have optimal health, and I have some weight loss of a certain percentage point, and that you work with some of those healthcare professionals to get you to that point. Breastfeeding, I think, is a really interesting time too, because there's a lot of things at play. Our parents are tired, right? It's a continuous. That's an understatement, right?
I am, right? And they're way past, but.
Oh, goodness. Yeah. So it's every 3 hours in the beginning. It's really challenging for people to think about anything else other than really feeding that child. But there's some things to be done, right? Making sure that you're optimally having your fluid intake, your electrolytes, that you try and do as much in terms of your sleep hygiene as possible, that you really get family members and your friends to help out when possible, so that when you are choosing activities, you choose activities that are for walking and going to a pool, or really kind of engaging and meeting with friends and family in an activity that makes you moving. That's just good kind of healthy lifestyle habits. And then really kind of finding foods that are good for you and your breastfeeding journey is important. There's a lot of resources out there, but I don't think we give enough guidance, even in the medical community, for our breastfeeding moms, how to really help them in that breastfeeding journey. Because, interestingly, breastfeeding is really important for a lot of different things. We know that cardiovascular risk for that mom it decreases when we have breastfeeding patients. Oh, yes. And I think putting that in context with good nutrition and good exercise is just like, it's more important than really any medication, I would say, on a population level.
And you said it before, and I just immediately struck me, give yourself grace. Yeah. There's a new life now that you're responsible for and responsible for yourself too. And come on, you're a parent, the tendency is to put the children first. And I completely understand that, keeping in mind too, that, you deserve some time to get back to the place that maybe you were before, maybe you wanted to be before, but remember that it is a journey, it's not typically a really quick thing, and just try to be patient and kind to yourself when you can. I don't think I could ever say that enough to any person.
Yes.
But yes, please be patient and kind to yourself.
For sure. I think we forget that. I first
yes,
forget that. You think
absolutely.
of them as the people you have to take care of. But if you don't take care of yourself, then you're not as good of a parent, right? Or
it's true.
You don't give as much quality of yourself. It's just not all about quantity, I guess.
That's it. So Sarah, thank you for coming back to the show today. But before I let you go, what is a final thought you'd like to leave the audience with?
Well, thank you so much for having me again. I always love your podcast. I would say thinking about just your medical journey, right? Your personal medical journey, how to optimize things prior to pregnancy is really important. But if you do find yourself pregnant and you feel like you have some chronic disease of any kind, it's really important to get the care immediately. And I think that could be provided and should be provided in a non-judgmental way for all our patients, and really finding a healthcare provider that's going to support you through that, not only during pregnancy, but really postpartum, and to be part of your armamentarium of people who are going to help take care of you.
And be careful with social media.
Oh, yes.
That's a good one. not just in this way, but I personally, I've had some concerns about my own weight over time. And, I'm on social media as most people are, and you see things, and it might not always be realistic. And again,
yes.
that goes back to that, understand your source of information, give yourself grace. And if you have questions, certainly please, or concerns, talk with your healthcare provider, or questions about something in particular, they can always contact us at MotherToBaby, including you down at MotherToBaby Florida.
Yes. Thank you.
Thank you. And that's going to do it for this episode of the MotherToBaby podcast. As always, remember to hit that subscribe button. That way you never miss a new episode of the show. And you can also go back and either listen or re-listen to some of the older episodes. If you have an idea for the podcast, or if you want to be on the podcast, we want to hear from you. So feel free to email us at contactus@mothertobaby.org. And remember, MotherToBaby is here to help answer your questions. You can reach us by phone at 866-626-6847, by text at 855-999-3525. You can visit our website at mothertobaby.org. There, you can find our many information pages, our baby blogs, links to our podcast, are hundreds of fact sheets that are free and available in English and Spanish. You can chat with a mother-to-baby expert, and you can find out how you can help with our pregnancy studies. Until next time, remember, Mother-to-Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.